We have the Labor Department offering to deploy thousands of Filipino healthcare workers to Europe in exchange for vaccines. To give us her reaction to this, we have Jocelyn Andamo. She is the Secretary General of Filipino Nurses United, joining us over the phone. Good afternoon, ma'am. First of all, have you heard any developments on this yet from our DOLE officials? And how are the negotiations going so far?
Good afternoon. Sorry, we haven't heard any developments yet. As far as we know, the DOLE said that that statement that the nurses will be allowed to be employed in UK and Germany in exchange of the vaccines, which make us very disgusted and frustrated. As an organization, we believe that nurses has their skills and the capacities and are qualified to work as registered nurses outside the country, specifically UK and Germany. And we hope that the DOLE respects our profession and recognize us as professional nurses. And we see this as two separate issues. We would like to reiterate our stand that the cap in the deployment ban be removed and nurses be allowed to work and live for abroad. And then with regards to the issue of vaccines, we hope that our government will procure the vaccine depending on based on the needs of our country.
All right. House Minority Leader Joseph Paduano said, ma'am, that the plan is beneficial because it leverages our resources. What is your take on this, and how do you feel about human resources really being swapped here in this proposition?
We agree that we are really very vital part of the resources of the country. But then, sana we are not considered, we are not treated like bartered goods. We should be respected as professionals and like any other human resource that we hope that we can be consulted and treated, and we hope that our nurses will really benefit and given the due respect, and they will be employed rightfully, and their rights to just wages and good work conditions will be assured by the government.
Right. With regard to timing, ma'am, is it a bit strange because we right now need more healthcare workers, I would think, in the country. Is the number of nurses on duty around the country taking care of this health crisis enough, in your opinion? Do you have numbers?
Based on our study, our nurses in the country are enough, but then our problem is that they are not maximized and capped by the government. So many nurses are not in the health service field. So we are saying that this deployment ban is actually not rational or not necessary if only the government is doing its job in maximizing and tapping nurses in the pandemic response. No? Ang problem po, ma'am, is that many nurses leave the nursing profession or the healthcare field because they are not well taken care of. At present, many of our nurses suffer and they get sick without benefits and without adequate support from their management and government healthcare system. So we hope that actually, ma'am, we think that SNU thinks that our nurses are really very willing to serve our country and still be part of this pandemic response. But then many of us are really tired, exhausted, and demoralized because they feel that they are not well taken care of, and they are left on their own.
All right. Thank you so much for your time, ma'am. Jocelyn Andamo, Secretary General of the Filipino Nurses United. Thanks for your time today.